Does medication help a client? Do you see possibility cure without medication?
Uh, well, um, the use of what are now referred to as psychotropic medications was initiated during the time that I was in my training in psychiatry, which would have been in about 1955, 56. The benefits of medicine for those people who were hospitalized in a facility like I was at were immense in terms of their being able to live day to day with less turmoil. And so I was quite impressed with what benefits there were with the medicines. The first of those medicines were used basically to treat schizophrenia. Relatively soon after that, the antidepressant medicines were introduced. And those are still two extremely valuable medicines for some conditions. Generally, unless a person has what I would describe as a thought disorder, which is usually schizophrenia, but some other similar conditions, or if a person has a serious mood disorder, such as the manic depressive disorder, I prefer that people not use medicines. I would make an exception for that. People who have had a very recent, severe and overwhelming traumatic experience may have some benefit from short-term use of the ones that are commonly referred to as moderate tranquilizers, anxiety-reducing agents, but only temporary use. For example, it was common when I was still in my private practice attending people in the hospital as well, and as outpatients, that when I found it necessary to treat a person in the hospital, medicines were introduced as an immediate measure to permit them to function sufficiently to get out of the hospital. So return to reasonably normal daily life. But physically, my offices were located close to the hospital, so that even when my patients were in hospital, they exited the hospital for 1 or 2 hours to participate in group therapy in my private practice office, and then return to the hospital. So I was integrating them into psychotherapy as if they were outpatients while they were still residing in hospital.
Okay, so this is beautiful. So,
and the idea was that when they left the hospital, soon thereafter, they would be stopping the use of medicine or on a program of reduction of use of medicine.
So this is a key. So the medication was given so that they can get out of the hospital. But what I see you is you made a combination of psychotherapy and they taking medication, and then later the aim was to reduce it.
Yeah.